There's much changing with Medicare these days, and the annual enrollment is just about here. If you need help choosing which plan is right for you, Nunez Incorporated can help you make the right choice. Licensed Medicare specialist Rafael Nunez Jr. offers professional services at no charge. He sat down with me to share why this means so much to him.
It started off with a personal story of mine. My dad went through a bout of cancer back in 2008.
Okay.
So he went through the treatments, all the chemo, all the quote-unquote good stuff to get through it. And luckily, on the other end, he came out well, I guess you would say. But however, he wasn't able to go back to work. So we had to struggle a little bit with our Social Security system to get him on disability. Once you got him on disability, I had this pleasant surprise that when you go on disability, you're able to obtain Medicare shortly thereafter.
Oh, okay.
So I thought, Medicare, now we're good, everything's good to go. So around the same time, I had sold my home and auto insurance business and started doing Medicare as a manager. And I met a buddy of mine who has now passed away earlier this year. But he told me that, look, Medicare only covers 80%. It doesn't cover prescriptions, doesn't cover any of all this other good stuff. Let's talk about your dad's situation. So we did. He set us up on the perfect plan for him at the time. And shortly thereafter, he told me, like, look, maybe you should think about doing this and transition from being a manager to becoming a Medicare insurance broker. So I thought about it, and shortly thereafter, I did. I decided to jump on board because many people needed help with their insurance, with their Medicare. And full circle, my mom ended up becoming my client afterwards, a couple years later after that. And so I'm really driven by that piece of it where seniors are targeted for many things. I mean, you see them targeted for all these scams nowadays. And so I try to help at least alleviate the piece of the Medicare for them.
Oh, that's fantastic. I mean, you lived it. You kind of know some of the flags to look for. What are some of the most common mistakes that you see?
Well, I see a lot of people have this groupthink where it's like, well, my neighbor, my brother, my sister, people at the senior center, the country club folks are telling me to go on this plan. Mm-hmm. And many times that plan could be a good plan, but it may not be a good plan for you.
Right.
We all have unique situations, whether it's socioeconomic, whether it's health issues. Somebody who is a millionaire has different problems than somebody who's doing it month by month.
Right.
Someone who has a clean bill of health is different than somebody who's taking 23 medications a day and seeing 10 specialists on a given year. So you want to have somebody like myself to help tailor a plan for you. Because otherwise you might be going through the loops, and you might get a good plan where, hey, I have this great plan with this food benefit card, but your doctor may not take it. So we want to make sure that your doctor accepts it, that your hospital accepts it, and that it covers your medications the way they need to be covered.
How do people know then if they're paying too much or they're missing out on benefits, if they don't really understand all of it?
Well, they really don't, and that's where you have to ask. And you don't want to ask Medicare, you don't want to ask your current insurance company, you don't want to ask an agent who only represents one company. You want to ask somebody who has a diverse set of insurance companies. For example, in this area, there are over 10 insurance companies that represent anywhere between 50 and 100 insurance plans. Mm-hmm. There's a wide variety to look at. So you might have this plan where you're paying a couple $100s a month in premium that you can find the same exact plan with a different company for less, or you might have a plan where you're not paying a premium but your copays are too high. So you want to pick up the phone, call, and then we could sit down, talk about your situation, and go from there.
How do people stay on top of Medicare changes? Because that seems to change quite a bit.
Well, for us, what we do is we train year-round.
Okay.
And so that's why having somebody like us in your back pocket is important, because it doesn't cost you anything to have us anyway. And so we stay on top of what's going on, whether it's a hospital system that is kicking out a certain insurance company and not working with them anymore, or vice versa. The insurance company doesn't want to work with the hospital because of contract issues or whatever it may be. Or maybe there is a medication that a certain company is covering now, but isn't going to be covering next month, or diabetes supplies, whatever it may be. So we do a lot of that. Like, for example, right now, there's a big insurance company that's going through a lot of internal changes very quietly. Nobody knows about it. Mm-hmm. I warned my clients about this back in October. I have a gentleman who I spoke with in February. He told me, hey, you know what, you put me on the right plan, Rafael, for the beginning. I'm good to go. Everything is fine. He calls me 2 weeks ago when I was in San Diego with my kids hanging out for vacation. He's like, Rafael, left me a voicemail. Raphael, you were right. I'm having issues with the company. I need you to call me. And we talked about it. We've been going through that with him. So we got to stay on top of what's going on.
So if you find something like this happens to you and you're not happy with your current plan, do you have to wait to open enrollment to change it, or can you change it before then?
Not necessarily. It depends. So it depends on your situation. It depends on your location. So there are opportunities. Like, for example, earlier this year, we had the storms that came through, the tornado that came through the area. If you were looking through a plan at that time and you couldn't change your plan because of that situation, they opened up what's called the special election period for you that extended the window to change your plan. So that's one of the opportunities. If you move in and out of a service area for your plan, you can make changes depending on your location. If you have Medicare, Medicaid, if you lose your coverage at work, there's anywhere between 15 and 20 special election periods that might apply to you at any given time during the year. Like even back then we had COVID and monkeypox. Those were election periods and people didn't even know they could change their plan at that point. So there's a lot of opportunities. That's why you want to pick up the phone, call and ask to see if there's an opportunity to make changes before open enrollment.
Yeah, have an expert like you there who can stay on top of all these things for them.
Correct.
Fantastic. Thank you so much for joining us.
Awesome.
We appreciate it.
Thank you for having me.
All right, grab those phones and scan the QR code on your screen for more information. You can also give them a call or visit RaphaelNunezJr.com.